Good evening and welcome to the webinar. Thank you all for attending. My name's Joseph DeBay. I'm a board certified nutritionist. I practice in Great Neck and I consult long distance. Our topic tonight is natural approach to autoimmune disease. There are about 80 different autoimmune diseases that affect millions of Americans, women more so than men, and that we're going to answer the question why that's so tonight. These are some of the more common autoimmune conditions. There's some evidence that heart disease may have an autoimmune component. If that's the case, then autoimmune disease is definitely the biggest killer in this country. Even without heart disease, it's a major cause of disability and early death. When it comes to immune system dysfunction, if your immune system is underactive against foreign invaders, you wind up with an infection. If it's underactive against transformed cells in your body, cancer results. If your immune system is overactive against benign foreign substances, you develop an allergy. When your immune system goes on the attack against your own tissue, that's autoimmunity or autoimmune disease. Why are we talking about a natural approach to autoimmunity? One reason is because of the side effects of conventional treatments. If we can reduce, or in some cases do away with, the need for conventional treatments, that's a good thing. Conventional treatments often have a lot of negative side effects. The powerful immune suppressing drugs can result in increased infections and cancers in some cases. And of course, other side effects can result from these powerful medications. Another reason for a natural approach is that other conditions will arise if the cause is not dealt with. So within a natural approach, I'm assuming we're trying to get to the underlying cause as well. Of course, you can have a natural approach that just substitutes for a medication without getting to the underlying cause. I recommend a thorough assessment to try and deal with underlying causes as much as possible. And another reason for a natural approach is prevention. And I'll be talking about that in some detail in just a minute. This is the cover of a Scientific American a few years back. Will you get sick? Antibodies could foretell the future of your health. Predicting disease. And this is all about autoantibodies, autoimmune disease. The New England Journal of Medicine had a paper in 2003, Development of Autoantibodies Before the Clinical Onset of Systemic Lupus Erythematosus, an autoimmune disease. This shows the timeline of appearance of antibodies that can be measured in the blood, and then the diagnosis of an autoimmune disease. And this shows a 6-year time lag between appearance of antibodies in the blood and diagnosis of the autoimmune disease. Lupus plus these other autoimmune diseases. Autoantibodies are immune system proteins that target the body for destruction. These are a big part of autoimmune disease, these autoantibodies. There are different autoantibodies that can be measured in different autoimmune diseases. So a person has these autoantibodies develop over time, and then eventually an autoimmune disease is diagnosed. So this is another reason why a natural approach is of value. If someone has a blood test and antibodies are picked up in the blood, of course you have to order them to check for them. I often do that with my patients. Conventional medical doctors, I think, are less likely to do that. But I use a proactive approach. And so if we pick up the appearance of autoantibodies in the blood and a person doesn't have a diagnosable autoimmune disease, a rheumatologist or other conventional doctor is not likely going to initiate any kind of treatment. The treatment is toxic, has a lot of potential side effects. So if there's not good reason to use the medication because of clinical presentation, then the doctor won't prescribe the medication. But with a natural approach, where the downside is low, where there's little toxicity, very little in the way of side effects, we can certainly initiate treatment and not be concerned that we're going to do harm. So when I have someone who has autoantibodies in the blood, we initiate some treatment, and very importantly, we look for the underlying cause or causes. Since this paper was published, there was another paper that I believe found could be a 10-year lag between the appearance of the antibodies in the blood and the development of full-blown autoimmune disease. It's best if you can pick it up early before there's major damage done. So on the left we have full-blown autoimmune disease, lupus, rheumatoid arthritis, Hashimoto's, multiple sclerosis. On the right we have optimal health and function. We don't go from optimal health to disease overnight. There's a process that takes place over time. And initially we're not even aware that things are beginning to malfunction in the body. It's not until we have signs and symptoms that we realize that something's wrong. But it's over here where we can pick up the autoantibodies. We don't have to wait for a person to deteriorate to the point where their condition can be given a label like lupus or rheumatoid arthritis or ulcerative colitis, whatever it may be. We can act earlier with natural approaches and help to move the person towards health. Your signs and symptoms, including diagnosis of autoimmune disease, is like the tip of an iceberg. The important thing is what's below the surface. And it's my experience that conventional medicine doesn't really bother too much with this question. In general terms, what's below the surface is altered physiology. Things aren't working properly. And that's a result of an interplay between genetics, genetic predisposition, which we can't change, and factors which we can change, toxicity. Anything that builds up in the body beyond a certain concentration becomes toxic, has a negative effect. For some chemicals, it's an extremely minute amount that causes problems. Environmental chemicals, medications, our own hormones and other biochemicals can be toxic. Waste products from intestinal bacteria, mercury from silver fillings in the teeth. Many different chemicals can be classified as toxins. Stress, for some people, this is the biggest factor. Food allergy, acquired or genetically determined reactions to foods. Nutrient deficiencies. We all have unique nutritional needs. If those aren't being met, they can contribute to autoimmunity. And imbalance in a variety of hormones. These factors interact with each other, and usually there's more than one problem area contributing to a person's poor health. This represents an individual's genetic potential, their genome. The genes have the blueprint for health and disease, the blueprint for all the chemicals that the body can make. The body doesn't make all its possible chemicals at once. It doesn't make all the biochemicals in every cell at the same time. Liver cell is different than a heart cell, which is different than a bone cell. There are certain genes that are active, other genes that are silent. Now when it comes to health and disease, the genes that are important are inducible. They're switched on or switched off depending upon different factors they're exposed to. So to put it simply, we have blueprints for health and we have blueprints for disease. And things we do on a daily basis determine which blueprints are being utilized. And with some investigation and planning, we can take steps to get the most out of our genes. These are negative influences on the genes, things that contribute to activation of disease-promoting genes, to put it simply. Nutrient insufficiencies, toxic overload, stress, insufficient rest, inadequate exercise, internal states like chronic inflammation, neuroendocrine or hormone imbalance. These things activate genes that encode for biochemicals that alter cellular structure and function and contribute to changes that result in signs and symptoms and eventually a label of an autoimmune condition. I like to know as much as I can about these different areas: the triggers, the genetics, the metabolism, and the signs and symptoms. And that way we can personalize the program. I get the information I need through consultation, questionnaires, laboratory tests, examination. Then we personalize the program and usually have a better outcome with personalization. Natural approach of mostly diet, nutritional supplements, exercise, stress reduction. We can improve the genetic expression, biochemistry, and a person will be healthier for it. Now, that's not to say that every autoimmune disease can be cured in this way, but most conditions can be improved to varying degrees. What causes autoimmunity? Is your immune system stupid? Not stupid, but in some cases confused. This represents body cells. This is the nucleus, where you find the DNA. Here comes a cell that doesn't belong. An E. coli bacterium. That causes your immune system to go on the offensive, go on the attack, and produce antibodies to kill the foreign invader. That's good. That's what your immune system is supposed to do, protect. Now, how does your immune system know to attack the bacterium but not attack you? There's something about your cells that your immune system can sense as friendly. There are molecules on your cell surface that your immune system monitors and realizes that it shouldn't attack. But that can change. One thing that can change it is toxicity. Environmental chemicals can interact with your tissue, alter the structure, and then you no longer look like you. So your immune system is not being stupid, technically, in attacking something that appears foreign. Your structure is changed, and now you no longer look like you. So this is one of the important factors that may contribute to autoimmunity in some cases. This is a study on the subject. In this study, they made a comparison between arthritis, especially rheumatoid arthritis, and blood levels of different environmental chemicals. And there was indeed a connection with higher levels of PCBs and organochlorine pesticides. There was increased incidence of rheumatoid arthritis. The study looked at autoimmunity in connection with dental amalgams, silver fillings in the teeth, which contain aluminum and, more importantly, mercury. Conclusion: results imply that in some patients with thyroiditis, mercury from dental amalgam can stimulate the production of anti-nuclear antibodies. Dental amalgam may be a risk factor in some patients with autoimmune disease. Anti-nuclear antibodies are immune system proteins that attack the nucleus of the cell, where your genetic code is, your DNA, your genome. So mercury from silver fillings is a potential contributor to autoimmunity and other diseases, I might add. And there are tests you can do to see if mercury is a problem for you. Glycation is the process of sugar damage. Sugar damages our tissues on a continual basis, more so with high blood sugar. And the altered tissue structure that can result from sugar binding with protein or other biochemicals can lead to foreign structures that cause the immune system to go on the attack. Estrogen metabolites can be another factor. There's not just one biochemical in the body that's estrogen. There are many chemicals that are estrogens. There's a metabolite of estrogen called 4-hydroxyestradiol, which can cause damage to the DNA and contribute to autoimmunity. And this is one reason why autoimmune diseases are more common in women. Women have higher levels of estrogen, lower levels of male hormones, androgens, which seem to be more protective against autoimmune disease. These biochemicals can be measured and they can be manipulated through natural approaches. Too much of these bad estrogens can be improved by cruciferous vegetables, extracts of cruciferous vegetables like indole 3-carbinol, exercise, weight loss, soy isoflavones, omega-3 fatty acids, reducing exposure to pesticides, foreign estrogens, correcting hypothyroidism. All those things can be helpful. But first, a test can be done to see if this is actually a problem for the individual. Not everybody needs to treat all of these factors. It's a good idea to have an evaluation to see what's imbalanced in your body, and it's most likely to give the biggest payoff. Here's a quote from a study. Data is presented that supports the postulate that structural differences in DNA due to the incorporation of oxidized guanosine results in the production of antibody that has been termed autoantibody. 8-OHDG is something that I routinely test patients for. It's a marker of free radical damage to the DNA, oxidized DNA, and this is a contributing factor to autoimmunity. If this is found, we want to take steps to reduce free radical production and increase antioxidant defenses. Here's a related subject, oxidatively modified autoantigens and autoimmune diseases. This is a summary of different factors I've come across that contribute to autoimmunity, initiating or exacerbating autoimmune disease. Oxidative damage, free radicals we were just talking about. Glycation, the sugar damage. Impaired methylation. This is a critical biochemical process that's dependent upon adequate B vitamin status. Maybe 1 in 3 or so Americans have a genetic impairment in making the active form of folate, which is very important, methylation. And there are a number of other natural factors that are important for proper methylation. And this is readily addressed through natural approaches. Sex hormone imbalance, especially certain types of estrogen metabolites. Inflammation, and there are many factors that contribute to inflammation. One is the standard American diet. Low secretory IgA. This is the most important antibody that protects the mucous membranes against infections and perceived threats. You find it in the gastrointestinal tract, respiratory tract, genitourinary tract. It binds to antigens, bacteria, viruses, parasites, fungi, toxins, food antigens. It helps to neutralize them and remove them from the body before they can penetrate and do harm. It's called the first line of defense. It helps to keep balance in the immune system. If your secretory IgA is low, you're more prone to develop an autoimmune condition. Insulin resistance, the pre-diabetic condition, causes all kinds of ill health effects besides elevated blood sugar and can be a contributing factor to autoimmunity. and probably up to half of Americans have some problem with insulin resistance. Visceral adiposity, too much fat around the middle. Toxicity, there are many things that qualify as toxins. Artificial dyes, which you find in medications and some vitamin supplements, in addition to foods. Leaky gut syndrome we'll be talking about in some detail. NSAIDs are non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, the prescription anti-inflammatories for arthritis. Radiation. If you go to your dentist and get dental x-rays on a regular basis, or chest x-rays, or possibly if you're doing a lot of flying, you get exposed to a lot of radiation. Vitamin D and vitamin A deficiency, tryptophan, niacin deficiency, probably other nutrient deficiencies. Infections, including oral infections. Dysbiosis, which is imbalance in the flora and the intestinal tract. Not enough good bacteria, too much bad bacteria, yeast, parasites. Stress, imbalance in the long-acting stress hormones, cortisol and DHEA. These can also become imbalanced from physical stress, inflammation, swings in the blood sugar. Gluten sensitivity. Gluten is a protein you find in wheat, rye, barley, spelt, kamut, triticale. Other types of food sensitivities, acid pH, and leaky gut syndrome, which we'll be talking about. So if you have an autoimmune condition, if you have elevated autoantibodies in your blood, I recommend looking into these various factors. There's a lot to deal with here. But whatever degree you pursue this, you're more likely to get to underlying causes. And not only can you be impacting the autoimmune process, getting to the underlying cause of the autoimmune process, but you're also going to be learning about something that's not working properly in your body that can also result in other conditions besides autoimmune disease. Okay, here's a study that found in certain people with genetic predisposition, having a bacterial infection in the stomach can contribute to autoimmune thyroid disease. Helicobacter pylori is a bacteria that infects the stomach and duodenum, contributes to gastritis and possibly reflux, and contributes to ulcer, maybe stomach cancer, contributes to other problems as well. It's a source of inflammation and may contribute to autoimmune thyroid disease. Gastrointestinal tract deserves a lot of attention in autoimmune disease and in health in general. Gastrointestinal tract is the main site of interaction between the individual and the environment when you think about it. If you took the surface area of the intestinal tract and laid it out flat, it would cover a doubles tennis court. It's home to hundreds of trillions of organisms, some good, others not so good for us. They weigh about several pounds in total. Gastrointestinal tract is the location of more than 60% of the immune system. All those bacteria in your intestinal tract, if they have access to your bloodstream, can readily kill you. So it makes sense that the immune system has to be policing the gastrointestinal tract. Most of the immune system is clustered around the gastrointestinal tract. If you have an immune problem, including an autoimmune problem, it makes sense to consider what's going on in your gastrointestinal tract. And there's two basic factors I think of. One is what types of organisms are there, and what kind of foods are you eating, or is your immune system having an adverse reaction to the food you're eating? This represents the intestinal tract. This is a single layer of cells. This is microscopic. A single layer of cells that lines the intestinal tract and absorbs nutrients. This is the interior of the intestinal tract with hundreds of trillions of bacteria, all the food. Think of this as the bloodstream. These are healthy cells, healthy junctions between the cells, healthy villi, these little projections that increase surface area for absorption of nutrients. The intestinal lining has to serve two important functions: absorb nutrients and keep out waste products, undigested food particles, bacterial debris, and whole organisms. In a healthy state, small, properly digested food particles are absorbed into the bloodstream to be used for energy and growth and repair. Large, undigested food particles are kept out. Bacterial debris is kept out. This is a healthy state. This can change. One thing that can change it is a bacterial infection. Bad bacteria can cause a breakdown in the intestinal barrier. You get a damage to the junction between the cells, and then you get large undigested food particles leaking into the bloodstream, and your immune system recognizes large particles as a threat. They more closely resemble an organism. And then the debris, the cell wall of bacteria, is a threat as well. That leaks into the bloodstream, setting off the immune system and contributing to the autoimmune process. Contributes to inflammation and toxicity throughout the body. This is an actual yeast passing through a leaky gut. Candida albicans yeast. That's going to cause a lot of inflammation. This is a paper by a world expert, leading expert on an autoimmune disease called celiac disease. Celiac disease is the autoimmune disease that involves damage to the small intestine in people who have a genetic predisposition to being sensitive to the grain protein called gluten. Here's a quote from the paper. "This new paradigm subverts traditional theories and suggests that the autoimmune process can be arrested if the interplay between genes and environmental triggers is prevented by reestablishing intestinal barrier competency." Dr. Fasano is saying that leaky gut syndrome is extremely important in autoimmunity. The autoimmune process may be arrested if the intestinal barrier is reestablished. If we heal the leaky gut, that can have a very beneficial effect on the autoimmune process. So we have genes, genetic predisposition, we have triggering factors, and we have the intestinal barrier as part of the equation. The healthy intestinal barrier helps to blunt the negative effects of these triggers on a genetic predisposition for autoimmune disease. Here's another paper from Dr. Fasano. Celiac disease insights, clues to solving autoimmunity. He talks about a trio of causes: genetic predisposition, a triggering factor, and leaky gut. This is his formula for autoimmune disease. Now, in celiac disease, there's one trigger, and it's known. It's gluten. In all the other autoimmune disease, there's not a single trigger. From individual to individual, I believe the trigger varies, and I believe there are probably multiple triggers. For a lot of autoimmune diseases, gluten is a big factor, a major factor. In an individual who's genetically sensitive to gluten, when they consume gluten, there can, for example, be a 10 to 30-fold increased risk for developing an immune attack on the thyroid gland. But there can also be increased autoimmunity involving tissues throughout the body. These are some important causes of leaky gut syndrome I've come across. And in a second, I'll be showing you one of the tests for leaky gut. So if you have a test that shows that you have what's called leaky gut or intestinal hyperpermeability, if you don't like that phrase, leaky gut, then we need to consider what's causing it. And you want to try and deal with underlying causes as much as possible. Non-steroidal anti-inflammatory drug therapy. Steroids. So if a person has arthritis pain, let's say they're taking Motrin on a daily basis, that may actually be a big factor in contributing to autoimmune disease by causing a leaky gut. Corticosteroids, steroid drugs, can do damage to the intestinal lining, contributing to leaky gut. Overgrowth of bacteria in the small intestine, lack of good bacteria, antibiotic usage, protozoal or parasite infections, gluten sensitivity, other food allergies, excessive fat or sugar in the diet, too much alcohol on a regular basis, excessive diarrhea, excessive exercise, stress, high levels of the stress hormone cortisol. Increasing age is a contributing factor. Nutrient deficiencies, especially protein and vitamin D. Vitamin D is very important for healthy junctions between the intestinal cells. If you're not getting enough protein, your body's going to break down your own tissue protein. And the two main sites that are robbed of protein are muscle and in the intestinal lining. That's one reason why I don't think fasting is a good idea. Toxins contribute to leaky gut. Hypoxia, very low oxygen, high blood sugar, and maldigestion, including low hydrochloric acid in the stomach. And people take medications that can induce low hydrochloric acid. Millions of people are taking medications for gastroesophageal reflux because their acid is coming back up into the esophagus. And incidentally, I'll mention that a lot of those people have reflux because their stomach's not making enough acid in the first place. Reflux isn't usually a problem of too much acid. It's acid in the wrong place. And people take medication to shut off that stomach acid, and that can cause a chain reaction, domino effect of unhealthy changes in the body, and may contribute to leaky gut syndrome, among other things. Alzheimer's disease appears to have an autoimmune component to it. Another important mechanism of autoimmunity is something called molecular mimicry. This is a little bit of a variation of what we've spoken about already. Okay, before I show you a little animation, here's a paper on the subject. Elevated levels of IgM and IgA antibodies to Proteus, mirabilis, and IgM antibodies to Escherichia coli are associated with early rheumatoid factor positive rheumatoid arthritis. So in these patients with rheumatoid arthritis, they found elevated antibodies to intestinal bacteria. And here's the connection. So we have on the left a leaky gut. On the right, we have the body's own knee joint. So with leaky gut, you have increased absorption of bacterial debris, large food particles. The immune system recognizes those things as a threat, goes on the attack. There are immune cells that go after those apparently threatening particles. The immune system produces antibodies that target the bacterial debris or the food particle for destruction. And then if there is an amino acid sequence in your knee joint that's similar to the amino acid sequence in that food or in that bacterial cell wall, your immune system thinks it's going after something foreign when it comes across your knee cartilage. This is called molecular mimicry. So a food particle, a bacteria in the intestinal tract, maybe other organisms, can cause the immune system to go on the offensive. And if there is tissue in your body that has a structural similarity to part of that food or organism, it's attacked. Again, leaky gut is involved here. If you do have leaky gut syndrome, besides looking for underlying causes, it's a good idea to use various nutrients to help repair the leaky gut. Glutamine is the #1 fuel source of the small intestine cells. #2 are short-chain fatty acids, which are produced by intestinal bacteria, and that can be stimulated by feeding them indigestible carbohydrates called prebiotics. So there's a variety of nutrients that are shown here that can be beneficial in helping to repair a leaky gut. Here's a study: zinc supplementation tightens leaky gut in Crohn's disease. It was a study of Crohn's disease, which is an autoimmune disease of the gastrointestinal tract, and it looked at leaky gut syndrome in people with Crohn's disease who were in remission. So they didn't have active disease. The disease was in an apparently healed state. They had no symptoms. If they had leaky gut, found on laboratory testing, there was 100% incidence of relapse within the next year, I believe. So that again shows the importance of leaky gut syndrome. And zinc is one of the things that can help to heal leaky gut, especially zinc carnosine. That's a special form of zinc, very good for gastrointestinal healing. The foods we eat contribute to inflammation in different ways, and inflammation can definitely exacerbate autoimmune disease. A diet low in arachidonic acid ameliorates clinical signs of inflammation in patients with rheumatoid arthritis and augments the beneficial effect of fish oil supplementation. Okay, I'll explain that to you with another slide. We'll be talking about arachidonic acid and fish oil. Arachidonic acid is found in animal fat, beef, lamb, pork, dairy, egg yolks, shellfish, and it is pro-inflammatory. It's converted to a pro-inflammatory chemical, prostaglandin E2. Fish oil is converted into an anti-inflammatory chemical. And DGLA is also anti-inflammatory. We don't have any supplements of DGLA. The best we can do is take a supplement of a building block called GLA. You find that in highest concentration in borage seed oil. With laboratory testing, with a blood test, we can measure these different fatty acids. We can measure the EPA from fish oil, the GLA, the DGLA, the arachidonic acid. These can all be measured from a blood specimen. There's the EPA, there's the arachidonic acid. This person has EPA on the lower side and a high arachidonic acid. That's going to make them pro-inflammatory, prone to inflammation. This person would be healthier for cutting down on those arachidonic acid-rich foods, also getting their insulin to work better if that's a problem, because that can cause the body to make more arachidonic acid from building blocks. And they'd also be served by taking some fish oil. The arachidonic acid gets converted into inflammatory chemicals, prostaglandins and leukotrienes, and the conversion can be inhibited by natural substances, different nutritional supplements. Caprex is a very effective formulation of combination of natural extracts, especially from hops. Caprex actually works upstream from these enzymes. Curcumin and boswellia are among the more effective natural substances for reducing the production of these inflammatory chemicals. Here's a study that looked at rheumatoid arthritis and found that a vegan diet helped to improve symptoms. The data provide evidence that dietary modification may be of clinical benefit for certain rheumatoid arthritis patients, and that this benefit may be related to a reduction in immunoreactivity to food antigens eliminated by the change in diet. So we're talking about food sensitivity reactions. So if you're consuming foods that your immune system doesn't like, that could be a negative factor for autoimmune disease. And the best way to find out about this, in my opinion, is a test that we can no longer do in New York State, thanks to the Department of Health. IgG4 antibodies. These are involved in delayed reaction to foods that can produce all kinds of signs and symptoms throughout the body, contribute to inflammation, and appear to be important in autoimmune disease. So we have 90 foods. The way this test works is your blood is put into 90 different little wells. Each one has a different food in it, and the laboratory measures how much antibody gets produced against the food, how much IgG4 antibody. These are all normal responses. We don't have any mild, moderate, or severe. Of course, the moderate and severe reactions are worse than the milds. And any of these reactions signify that a person's probably going to be healthier if they cut these foods out of their diet. There's usually an improvement in a variety of signs and symptoms when people cut out the foods that their immune system is reacting to in this way. Many people I test have absolutely no IgG4 reactions. That's normal. This number of reactions is consistent with leaky gut syndrome. This is the way I've been relying on picking up leaky gut syndrome. But unfortunately, this test is no longer available in New York State. I'm going to have to go to Plan B. So there are some other tests. There's another specific test for leaky gut syndrome I know is also not allowed in New York State. There's a third one I'm going to have to look into. There's a fourth one I know of, but it's not a value really. So there are laboratory tests that can be done to see if you have leaky gut syndrome. If you don't live in New York State, you're fortunate. These tests are more readily available. And if you have leaky gut, you certainly want to do something about it. If you don't do any testing, there are still ways to deal with food sensitivity reactions, and that's through an elimination diet. I have kind of a core autoimmune program. Regardless of any testing, we can put a person on a program that's going to do them some good, and that consists of an anti-inflammatory elimination diet. So that's a diet that removes inflammatory foods, pro-inflammatory foods like the foods that are high in arachidonic acid, and it's a diet that removes the common allergens like dairy and gluten. We remove alcohol in the diet. Some other factors, coffee, people don't like to part with sometimes. So there's a number of foods that are cut out on the elimination diet, and I have people follow that for at least 3 weeks before we start adding back those foods one at a time, and we check for reactions to the food. And if you get a reaction after you've been off the food for a few weeks, it's possible that we may have picked up a sensitivity reaction. We have to do an additional test to double check on that. In addition to the diet, my core program involves this medical food, Ultra-Inflamex Plus 360. This is a medical food, which means that it was developed for a specific purpose. It's to be used under the supervision of a healthcare professional. It's been tested on people and found effective. Ultra-Inflamex Plus 360 is great with all autoimmune conditions. It's hypoallergenic food. It's got protein, carbohydrate, fat, fiber, vitamins, minerals, amino acids, plant extracts. It's anti-inflammatory. It's a potent antioxidant. It has nutrients to support detoxification enzymes. It's got nutrients to give some support for healing a leaky gut. It has nutrients that help to improve the functioning of enzymes that are malfunctioning in autoimmune disease. So this is a very beneficial product with any kind of autoimmune condition. Then EPA DHA 720 is one of the potent fish oil products that I use. Fish oil is usually a good choice with autoimmune disease. Sometimes other oils are beneficial. Sometimes borage seed oil is a good choice, and that can be determined with some blood testing. Here's the results of one study using this approach of ultra-inflamex and the elimination diet in patients with rheumatoid arthritis. 28 patients over the course of 12 weeks, there was a 62% decrease in swollen joints and a 47% decrease in blood marker of inflammation called C-reactive protein. And you don't have to worry about side effects with a natural approach like this. Again, with immune system problems, if we have too little activity against foreign invaders, infection results. Too little activity against transformed cells, cancer. Too much activity against benign foreign substances, allergy. Too much activity against our own tissues, autoimmunity. There are some natural products that can help to balance the immune system. One is called transfer factor. This is a product I use with most of my autoimmune patients, Autoimmune TF. This has colostrum and transfer factor in it. And here's one paper about transfer factor. There's been about 4,000 papers published on transfer factor. Regulatory processes are an appealing target for therapeutic approaches aiming to solve allergic reactions by restoring the delicate balance within the immune system. Transfer factor may restore the Th1, Th2 balance and improve immune regulatory mechanisms of patients receiving it. Th1, Th2 imbalance plays a role in autoimmune disease. Transfer factor has been used to treat a variety of immune dysfunction-related pathologies such as allergy, autoimmunity, immunodeficiencies, infectious diseases, and tumors. So transfer factor can be a helpful adjunct. I've seen patients with various autoimmune diseases have fairly rapid, significant symptomatic improvement from using this product. It's effective with other conditions in addition to autoimmune disease. If you have an autoimmune condition and you want to get to underlying causes, those list of different contributing factors we covered earlier on, these are laboratory tests that will cover that information. 8-OHDG, that's a free radical marker for damage to the DNA. And that's a urine test. That's a specialized test. That's an out-of-network laboratory test. I use Metametrics Laboratory for that. Hemoglobin A1C, that's an indication of glycation. That can be done from any laboratory. Homocysteine can be done from any laboratory. That's an indication of methylation. HSCRP, C-reactive protein, that's a routinely available laboratory test for inflammation. Out-of-network specialized test. Expanded female hormone and male hormone panels from saliva measuring sex hormones. Estrogen measuring the estrogen metabolites. That can be done from urine and I believe also blood. Insulin, C-peptide, 2-hour glucose insulin tolerance test. These are some tests for insulin resistance done by any routine laboratory. GI effects, gastrointestinal effects test, not allowed in New York, but there are other similar tests that are provided by other functional medicine laboratories looking at parasites, yeast, bacteria, markers of inflammation within the intestinal tract, digestion, absorption. Intestinal permeability tests of different types for checking for leaky gut syndrome. Adrenal stress index test for measuring salivary cortisol and DHEA, long-acting stress hormones. If you have an inflammatory condition, maybe your body's not producing enough of its major anti-inflammatory hormone, cortisol. That's one of the values in doing that test. Gliadin antibodies to check for gluten sensitivity, and there are different laboratory tests for this. I recommend patients start with what's covered in network with any commercial medical laboratory. If results come back normal, we could always pursue more specialized laboratory testing. Food IgG, if you don't live in New York, that's great. Otherwise, we can't do that in New York. That's a test for delayed sensitivity reaction. Urine porphyrins, also we can't do in New York. That's a great test for metal toxicity. That shows if the metals are adversely affecting your biochemistry. What we can do in New York is measure levels of metals in the blood and urine. Bioimpedance analysis, that's a test I do in the office that measures body composition. We see if there's too much body fat. We also see if there are indicators of toxicity with altered intracellular, extracellular water balance. Vitamin D, that can be done by any commercial laboratory. And urine pH, that's a test you can do at home. I actually have patients measure saliva pH as well to see if their body is too acid, and we need to work on that. So again, this is a summary of evaluation that can be done to look for underlying causes that may be contributing to your autoimmune condition. And I recommend dealing with underlying causes as much as possible. If you haven't been to my website, this is what it looks like. I have a lot of information there, about 50 articles I've written, a recording of a few webinars, and a page that describes some of the special functional medicine laboratory testing I do. There are patient testimonials. I have video testimonials of patients with a variety of autoimmune conditions you can take a look at. There's some self-tests you can do. You can sign up for my newsletter and get announcements for future webinars and seminars. And at this point, I'll open it up for questions. My website, by the way, is drthebay.com. And any questions? Go ahead and type those in the box on your screen. We'll give it a few minutes, see if anyone has any questions. Thank you all for attending. I hope that's been helpful information. So far, no questions. Give it another minute. I'm not sure if I'll be doing any more webinars before the end of the year, getting near the holiday seasons. I don't know if people are going to be too interested, but I'll probably start up again in January. If you're on my email newsletter list, you'll be getting an announcement, and you can always go back to my webinars page to check as well. Again, that's on drthebay.com. Okay, well, before we close, I'd just like to give you another minute to ask a question if you'd like to type it in. I'd like to thank you all for attending. Okay, looks like there's no questions. I hope the information's been helpful. And if you think of questions later on, you can always email them to me. Okay, everybody. If we don't meet again before, Merry Christmas, Happy Holidays, Happy New Year, and I look forward to next time. Thank you for attending. Good night.